reproductive practice, the largest outside of the East Coast. We have 9 offices, but my main offices, I have 2 offices that we go back and forth from. Where the primary office is in Rancho, which is a bedroom community near the Claremont colleges, a little bit east of there. And then our high-level, highly complex laboratory is in Pasadena, where we do retrievals. Just a little bit as a background about myself. I'm from Los Angeles originally. I grew up on the west side. I'm a double board certified reproductive endocrinologist. I went to undergrad here in the Bay Area. Go Bears. I see a little bit, I like that lid over there. I like Stanford people also. I'd love my child to go to Stanford, that's okay. I then went to medical school at the Royal College of Surgeons in Europe and did my residency in obstetrics and gynecology at Albert Einstein College of Medicine program in New York City. My dad is from New York. I always wanted to live in New York, and it was great. I worked like a dog, but when I wasn't working, we could bop around the city and listen to the Strokes. But I was recruited down to the National Institutes of Health for fellowship, which was amazing. The NIH is the mothership for American healthcare, I should say. And the reproductive program, we were aligned with many of the high-level PhD laboratories, really pushing the envelope with oocyte egg development, sperm-egg interactions, and advanced scientific reproductive care. And we also worked with a large fertility clinic that has definitely a different model than our practice, but called Shady Grove, where they are a lot more communal. They have a doctor of the day, they do retrieval, a doctor does transfers, and it's a lot different from our sort of model. I've been blessed to have 3 kids. The oldest is 7, 5.5, and 1.5. Coco, or Caroline, the girl, is wonderful. She was a product of IVF herself because fertility happens, right? Fertility happens to all of us, especially physicians who put off life and healthcare till we're later and trying to do the right things as far as buying a house, job development, things like that. Back in the day, I still do run, but I ran 3 marathons during medical school. I love getting into the outdoors. Trail running is sort of my go-to happy place. So now, just focusing a little bit more on some things that we can sort of better control and get a little more insight in things as we sort of move on to this journey of adding to our family. I tell all males, every man should be doing his best to try to take a regular multivitamin. In men, where we do a semen analysis and there's little, let's say lower movement, lower shape of the sperm, things like that. We also recommend adding in antioxidants, things like vitamin C, coenzyme Q10, also eating foods of the rainbow. So berries, things that have color are also very healthy. Trying to eat more of a whole grains, whole foods type of diet. I tell folks if they eat fast food, stop. If you drink a lot of fruit juice, sodas, try to do your best to minimize those. My preferred beverages are water with bubbles, a little tea, a little coffee. Of course, try to avoid tobacco. Another way to optimize male reproductive health is exercise, 20 to 30 minutes of cardiovascular exercise 4 to 5 times a week is healthy to help improve sperm and semen parameters. So the main initial evaluation for men is going to be doing a complete semen analysis. And you want to make sure that you do it at a fertility center and not just like at the local hospital. And the reason for that is that we get a strict morphology, which is the strict shape of the sperm. The first parameter outside of pH, volume, viscosity, all these different things, is going to be concentration. How much sperm are there, million per milliliter. Also how well they're moving, how well they're swimming. It was interesting. I reviewed in a semen analysis earlier where a gentleman had very low motility, but of the sperm that he had, the ones that were moving rapidly in a straight line. So that's a little bit more favorable. That will help us when we go to fertilization using that technique ICSI or microfertilization. It'll help us better identify the best sperm. So even though he had very low motility, 80% of them weren't even moving, he had 13% that were moving and 10% were rapidly moving. So that was more favorable. The shape of the sperm is highly predictive of male reproductive health. It's the parameter that is really probably the more important. And then here, oxidative stress. I know there was a physician who was talking about this earlier. There are a lot of fancy sperm tests out there. The evidence for them, especially in men like yourselves, who, for all I know, you are perfectly fertile, right? I know it's a little bit silly, but you just haven't exposed an egg properly, right? So oxidative stress assays, DNA fragmentation, episoma, things like this, I don't think they're as indicated. Now, that being said, I do order them. My nurses are my witness that in women or couples, even surrogates who've had recurrent miscarriages, then men can be a cause of miscarriage, especially when their sperm DNA is highly fragmented. So occasionally, it's not to say that I've never ordered it before. Genetic screening, I know this came up before. Excuse me. Prior to pregnancy is an ideal time to do a simple genetic test. It's a little bit of the 23andMe, but less about all that like fun ethnic stuff and more about disease, right? So what this is it's why, by the way, it's why we don't marry our brothers and sisters, right? Remember, being human, we all carry silent mutations. So many of them are autosomal recessive, meaning that you're just a carrier. And you want to know that the person you're going to procreate with, or your egg donor or yourself, if you carry a rare condition, we want to make darn sure that your egg donor doesn't carry the same one. Some inherited diseases are sex-linked, things like hemophilia, particularly that affects men. It's carried on the X chromosome. If you're ever bored, you can go on Google Scholar and look up my name and look up hemophilia. Back when I was in medical school, we did a large study looking at hemophilia and knee joint replacements at UCSF, using the UCSF and Stanford data set. So it's pretty cool. We determined that it didn't matter if these guys had HIV, it was more their disease. So it was just sort of, research and science matter. If you're ever bored or curious, please follow my professional Facebook page. One of the hashtags that I put out is Science Matters. Science is cool. It allows, reproductive health so much. It also prevents disease. So here, the last couple slides are some of the things this is just what I showed before in, the selection of the embryo. Remember, we start at the 1 cell, 2 cells, 4 cells, 8 cells, and compaction, and then beautiful expansion, 128 cells prior to implantation. So really why I put this back in is because I wanted to show you my video and let you know that So here's this, 1 cell, 2 cells, this is day 2, 4 cells, this is what we all look like, which is crazy. 8 cells. This is where the embryo is in the fallopian tube, moving towards the uterus. It goes through compaction, and then this is awesome. Right here is when you go through that beautiful embryonic expansion. And that's where, especially between days 3 and 5, is when the egg and sperm genome are working together to really develop into that embryo expansion. So here, right in this portion, I guess it's not showing, but this is the baby portion, and then the outside is the placenta. You see there's a little dot sort of at, let's say, 9 o'clock. That's the inner cell mass. That's what develops into the baby. So success rates. What I tell folks with fertility issues, not necessarily this group, is that I have an overall likelihood of success in favorable patients of 85 to 90% in a live birth. In folks like yourself working, because all I know is you're perfectly fertile, and we're working with healthy young egg donors, our overall live birth rate during your lifetime should be very high. Important factors to consider are very much selecting an optimal donor. I very much agree that choosing a donor with good, healthy eggs, good resting follicle count is key. We want to make sure that her AMH level is strong and adequate. Surrogate, I talked about that a little bit this morning, medical history, obstetrical history. Actually, Deanne, my nurse, brought this up just a minute ago. So with the surrogate, we work with local surrogates. But I fully understand that some California surrogates can be a little more expensive, or a fair bit more expensive. So we do work with surrogates from other parts of the US or even Canada, but I require that I see them in our office where I do a saline ultrasound myself to make sure that her uterine anatomy is just right. Before that, we may do Skype or video call or things like that just to sort of chat, but we see them initially, and then we of course need to see them on the day of implantation. So the surrogates themselves can monitor outside and still have very high level success. So now just to talk a little bit more about HRC Fertility, about ourselves, about myself and my team. First and foremost is high success rates. That's why we're here. We are extremely focused on this. We look at this weekly, monthly, yearly success rates, compare myself to my partners, to my prior years, and assess the role. Did chromosome screening really improve our pregnancy rate? Did it not? What about in our egg donor group or not? Things like that. I hate the second one, but it's very true. Individualized patient-centered care. What the hell is that? Like, what that is you have a dedicated doctor, you have a dedicated nurse. All my patients have my cell phone number. Honestly, many of them don't use it, and they don't need to because my nurses are so thorough. But just in case, egg donor, surrogates, if there's a quick medication question, I'm like, thank God you called. Oh my gosh, yeah, it's easy. You just put 1 cc of water in here and mix it, or whatever it might be. But those sort of things are extremely rare. Our nurses are extremely dedicated. This is their life's work. This is their career. This is our career. They often will have iPad with WeChat accounts, with texting, things like that. We're a large practice, like I mentioned, but what we do is individualized granular care. It's all about that doctor-patient interaction. And that's what I think allows that higher level of success. Being part of a large practice is good though, in the sense of being at the forward, the leading edge of technology. EMD Serono, very good pharmaceutical company. They did a lot for developing reproductive medications. Whenever they develop a new medication or a new screening platform for PGS, screening the embryos, they need large clinics like ourselves to send these through randomized clinical controlled trials. So that's where I think HRC is a practice that is really beneficial. Locally, you heard me, I'm an adjunct professor at local medical schools, which is wonderful, and also nationally on different committees. This is a little bit of our office here in Rancho underneath the San Gabriel's, beautiful. It takes a village, it takes a team. These are some of our andrology experts. We have all sorts of certifications, CLIA certified, FDA certified. We get inspected by so many different outside agencies. The embryology team, the team that handles the eggs and sperm, are highly dedicated. Some of them are PhDs, HCLDs, highly complex lab directors. Useful links, you might want to take a little screenshot of this. The ASRM, I know that Dr. Silvestre was mentioning this. SART.org, these are wonderful organizations. Path to Parenthood, I'm a board member of. We do a lot for the LGBT community. The Cade Foundation gives grants for reproductive health, reproductive care for $5,000 to $10,000. Live Strong, God love Lance Armstrong. I know he's a little bit polarizing, but wow, did he create a legacy in terms of helping guys with testicular cancer have reproductive health later on. You know the reason why most men don't freeze sperm if they have cancer is their doctor didn't tell them. It's ridiculous. Guys just need a magazine and a cryobank, and they're good. Their reproductive health is good, even if they have testicular cancer. So anyways, this is our contact information. Feel free to follow me on, or video, I guess, Facebook, and there you go. Sorry. The Olympics are coming, right? There you go. All right, the Winter Olympics. Anyway, so I think I'll leave it there. Hopefully you got a little better of a sense of me and our practice.